Hi, I'm Daniel Hershey's Espelita, and today I'm going to perform the female urinary catheterization. The urinary catheterization is the introduction of catheter into the urinary bladder through the urethra. This is usually performed only when absolutely necessary because danger exists in introducing the microorganism into the bladder. So those clients who have lowered immune resistance are at greatest risk of acquiring it. So moving forward, we have to assess the client's need for catheterization. Then we have to review the medical record of the client, see if there is any medical or pathological condition that may impair with the passage of catheter. Then we have to also look for any record of for allergies. Then identify the client's gender and age. And last is to verify the doctor's order. So there are indications for catheterization such as urinary retention. So the urinary retention is the impaired emptying of the bladder that causes the urine to accumulate and the bladder to be over distended. So and next is we also have neurogenic bladder. So this is the impaired neurogenic function that may interfere with the normal mechanism of urine elimination. So next I'm going to indicate the materials that we're going to need. So we have sterile and non-sterile gloves, a tape, betadine, um, lubricant, syringe with sterile water, cotton swabs, drapes, and catheter. So after that, we have to perform hand washing to avoid the spreading of microorganisms. Next is to greet and identify the client, explain the plan and procedure. So this is used to relieve discomfort due to bladder distension. So it can also be used to emptying the bladder prior to surgery, and sometimes it is used to obtain urinary specimen. So we can also have in the catheter kit a specimen cup. So next is we have to provide privacy because the procedure is going to expose the private part of the client. So we may close the door or draw the curtains. Next is to place the client in the appropriate position so we can obtain assistance to other members if necessary. So um, place the client in supine position with knees flexed about 2 feet apart and the hips are slightly externally rotated. So this is to to do the procedure easily and obtain a better view for the insertion of catheter. So also remind the client that in this procedure they may feel uh, the urge to void, or it may also cause a burning feeling. So after that, we have to place the or adjust the bed in a appropriate height to avoid our backs to avoid our backs in restraining. So next is we have to um, establish an adequate light. So I'm going to open the lights to um, um, better obtain a better view of the um, external meatus of the patient. So if you're right-handed, you must stand in the right side, and since I'm left-handed, I'm going to stand in the left side. So last is to apply sterile technique during the whole procedure. So um, a mistake in doing or a mistake in um, spreading the microorganisms in the sterile field may cause the patient to have infections such as urinary tract infection. So first I'm going to perform hand washing. Then I'm going to wear clean gloves. So next is I'm going to place the drapes under the client's buttocks. So I'm not going to touch the center of the drapes to avoid contaminating it with my hands. Next is I'm going to place another drape. Exposing only the area that is involved in the procedure. So the next thing is I'm going to remove my clean gloves and dispose it. Next is I'm going to get my sterile gloves using the sterile technique. Now I can adjust the gloves because both gloves are inserted. So I'm going to dispose this. So next is I'm going to prepare the lubricant. So I'm going to put this in the sterile field, then dispose it. Then um, uh, first is we have to also prepare now the syringe with sterile water. So I'm going to insert this beforehand on the here. Then what we do sometimes is we have to check for the retention of the balloon if it is working or functioning normally. So sometimes the balloon is malfunctioning, so we have to know that beforehand so that we can avoid effort in inserting the catheter. So assuming that this is already inserted here and we already checked that the balloon is working normally. So next is we're going to put betadine on this area. Then, um, using your non-dominant hand, so um, I'm going to hold the labia of the client and um, put a betadine on the side farther away from me. So, one, then discard. Next, on the side that is near me, one swab, discard. Next, on the middle side of the lab of the um, perineal, so one swab, then discard. So my non-dominant hand is already accumulated with dirt. So this is already um, dirty. So next is we're going to lubricate the catheter about 1 to 2 inches. Then before instruct the client to relax. So and um, before inserting it, we have to instruct the client to take a deep breath. So inhale, then after the client exhales, you have to insert the catheter. So, assuming that there is a urine flow, check for the um, continuity and the color of the urine. Then after that is we have to advance the catheter around 5 centimeters or 2 inches to get the catheter onto the bladder of the client. So after that is we have to inflate the retention balloon when the catheter is already on the bladder of the client. So assuming that the balloon is already inflated. Next is we're going to place the catheter bag on the side where the client's lower than the client's bladder. Next is we're going to clean the part or area that has excess, that may have excess lubricant or spilling of leakage of urine. Then after that is we're going to remove the drapes. So secure the catheter on the inner thigh of the client using a non-allergic tape. So this is to avoid the urine from backflow or that may cause discomfort to the client. So after that is I'm going to remove my gloves. And I'm going to dispose this. And then after that is I'm going to dispose all the materials that I used. Then I'm going to perform hand washing. Then next is I'm going to document the findings, and any unusual findings must be reported to the physician. Thank you.